Hi everyone, welcome back to your channel Ilovepharmacology. In this live session, let us learn about drugs which are useful in the treatment of bronchial asthma. So as you can see in the diagram, this is the diagram which is helpful in learning which are the target sites which can be found to treat the bronchial asthma. So as you can see here, once the antigen binds to the IgE receptor which is present on the mast cell, so this is the mast cell. So this is the mast cell. Inside the mast cell there is a leukotrienes. These are the leukotrienes which are the inflammatory mediators. So once the antigen binds to the IgE, so there will be activation of mast cells and this will lead to degranulation. So degranulation will lead to release of leukotrienes, and these leukotrienes will going to act on the cis leukotriene 1 receptors. So upon activation of these receptors are present on the bronchial smooth muscles. So there will be bronchoconstriction which leads to difficulty in breathing. So what are the target sites you can identify? So we have a first target site that is the IgE. So we have a monoclonal antibody that is omalizumab, which is an anti-IgE antibody which inhibits the activation of IgE mediated activity. Second step is the inhibition of the leukotriene synthesis. So this will be done by the corticosteroids as well as the xylitol. As you know that corticosteroids inhibit the phospholipase A2 pathway, phospholipase A2 enzyme, which mediates the conversion of the membrane phospholipid to arachidonic acid. And we have a xylitol which is a lipooxygenase inhibitor. So lipooxygenase is the enzyme which is involved in the conversion of arachidonic acid into the leukotrienes. So by giving xylitol, you are going to inhibit the lipooxygenase activity and there won't be production of the leukotrienes. So next target site will be to prevent the degranulation. So this can be done by the mast cell stabilizers. We have a chromoglycate, nidochromil and the ketotifen. So next fourth target site will be to attack the cis leukotriene 1 receptors, and you need to antagonize that receptor. So you're going to prevent the activation of these receptors. So how you will going to do it? So by giving a leukotriene receptor antagonist, we have a zafirlocast, montelocast, etc. So then we have a fifth target site at the bronchial mucus. So you need to prevent the bronchoconstriction. So basically you need to increase the activity of beta 2 receptor activation. So this can be done by beta 2 agonist, that is salbutamol is the example, whereas M3 receptor antagonist, also M3 will be there. Activation of these will lead to bronchoconstriction. So by giving a M3 receptor antagonist, that is ipratropium bromide and the thiotropium bromide, you will be able to overcome the bronchoconstriction. Then we have phosphodiesterase 3 activity. So by inhibiting phosphodiesterase 3 activity, that is the theophylline, by theophylline, basically you are going to increase the relaxation by increasing the cyclic AMP levels. So these are the 5 target sites which are available for the treatment of bronchial asthma. So if in your exams, if they ask about the drugs which are used in bronchial asthma, please do remember this flow chart. So first will be your omalizumab monoclonal antibody. Then next you have a corticosteroids and the xylitol. Next you have a mast cell stabilizers, and fourth group will have a leukotriene receptor antagonist, and next you will have a beta 2 agonist, M3 receptor antagonist and the phosphodiesterase 3 inhibitors. So this was about the very important groups of drugs that can be used in case of bronchial asthma. So if you find this video useful, please do subscribe to my channel Ilovepharmacology, and do not forget to share and hit the like button for more updates on pharmacology. Thank you.